Welcome to Caring for People with Dementia, a primary care partnership. This is Lesson 2, Sharing the Diagnosis. Studies have shown that only 45% of patients who received treatment congruent with an Alzheimer's diagnosis said that they had been told that they had Alzheimer's. Other studies have indicated that nearly 50% of physicians routinely did not share a diagnosis of dementia with their patients. Medical providers have reported general discomfort in sharing the diagnosis. Factors that contribute to this include concerns about the negative emotional impact on the patient, a lack of confidence in the diagnosis, an absence of known treatment options, and feelings of insufficient training and knowledge about dementia. However, research and practice has shown that overall, the large majority of patients want a diagnosis. While it is understandable that patients feel anxiety and perhaps devastated from this diagnosis, which is life-changing, people have reported feeling empowered, relief in having symptoms explained, and better prepared to handle their condition. Given these factors, people with dementia and their care partners report unmet care needs from their primary care providers, particularly in how they share the diagnosis and the type of information they share. As a result, patients and families feel unprepared to cope. In the spirit of patient and person-centered care, starting from the perspective of people with dementia and their care partners gives important information about their experiences that can inform how they can be better supported. Here are some of these perspectives.
Is realize that this isn't a diagnosis for a cold. This is a life-changing diagnosis, and maybe treated with that gravity, because it will change people's lives in a very serious way.
It was an extremely sad day. We felt hopeless since we had that experience that we experienced that already with my grandmother. So we were really we were devastated. It was a devastating one.
The doctor should be talking to you and not typing notes on the computer. The doctor needs to listen to what's going on and be empathetic that, your life is getting turned upside down that day.
So I would just say with the doctors, just make sure that the caregiver understands that they have to be very patient. They have to be very loving. Sometimes you may have to walk away and let someone else come in and take over for a little bit. But don't feel like a failure, because there's nothing that you can do to reverse it.
These perspectives, coupled with research and practice, have helped develop best practices in sharing a diagnosis of dementia. Some of these best practices include: use appropriate terminology, avoid minimizing or using vague terminology like a touch of dementia. Explain in clear, plain language. Address and involve the person with dementia. Involve care partners as much as possible and governed by privacy policies and the wishes of the patient. Leave enough time. Pause for understanding and questions. Offer hope and focus on strengths, what a person can do. Provide follow-up information, written information, or other resources. The following clip provides an example of these best practices in action.
So, Mrs. Wilson, we've been talking over the past few months about your memory loss, and we've done some tests to try to see where those changes are coming from. As we talked about before, there are a lot of possible reasons for memory change and some of the other symptoms that you've had, and we wanted to rule out those causes. Dementia is one of the possible explanations for memory loss, so we were trying to see if your memory loss was related to dementia or something else. This was important to know to understand what treatment options we would have. And if it was dementia, we wanted to find out what type of dementia, whether Alzheimer's disease, vascular dementia, or some other type.
Okay.
So I looked at the results of your blood work, your brain scan, and the cognitive tests we gave you. The cognitive tests were the ones we gave you to check on your memory, your attention, and other brain processes. The results of your blood work are normal. With the brain scans, we did not see any tumors or evidence of stroke that could be causing your memory loss. We could see in the results of the cognitive tests that you had difficulty with them. looking at all of these different pieces, Mrs. Wilson, they do suggest that you have dementia caused by Alzheimer's disease.
Oh, baby, it's gonna be okay. It's gonna be okay.
I know this is a difficult thing to hear, and I know that we'd hoped for better news. I would like to tell you what this diagnosis of Alzheimer's means, and then give you a chance to ask questions. Before we talk about what I suggest we do, I want to stop, give you a chance to ask questions, and take a breath.
We're gonna work through this, baby. We're gonna work through this. Doctor, are you sure it's Alzheimer's?
We have ruled out all other possibilities.
Baby.
Now, this is a realistic explanation for what you are experiencing. When we look at all these things together, it points to Alzheimer's disease.
So, what is the prognosis? How is this going to move forward?
Now, Alzheimer's disease is progressive. That means that over time, the symptoms tend to get worse. It looks different for each person, in the sense that some people have trouble with some things more than others. It is important to know that people can live well with Alzheimer's disease. We want to work on what you can do, and then make plans for what will happen as the disease progresses.
What type of treatment can I do?
You are early in the disease, so there are some things we can get started on right away to help with the symptoms. Of course, it's not just about medications. From a medical perspective, we want you to be healthy and be at the best you can be. That means healthy eating and exercise,
Okay.
making sure to take care of yourself, and spending time with the ones you love.
I know I will have more questions.
This is a lot to take in. I'm sure you've done your own research and will continue to do more. I want to help you out with this. This is the beginning of the conversation. My goal for today is that you leave the office feeling like this makes sense. I know you'll have more questions as we continue this conversation. We will schedule several appointments over the next few months to answer any questions and talk about what we can do to treat this condition and work towards ensuring the best quality of life. I have some information I'm going to send with you. It's never too early to reach out to a resource like the Alzheimer's Association and see what help they can provide you as well.
These best practices might help diminish the discomfort of sharing a diagnosis and empowers patients so that they feel better prepared to cope. How the diagnosis is delivered provides a foundation for an optimal relationship that facilitates quality of care, such as patient and family willingness to openly share symptoms, concerns, developments, as well as willingness to follow recommended care planning and treatment options. Primary care providers play an important role in supporting people with dementia and their family members, from diagnosis and through ongoing treatment, care management, and support. As you look for opportunities to apply what you've learned, consider trying one of these microsteps. Determine how you or members of your team can spend more time with patients with dementia during office visits, especially when communicating a diagnosis. Practice pausing and asking patients and their care partners their understanding of the diagnosis or information you gave. Prepare and practice an elevator speech that includes offering hope that a person can still live well and focusing on what the person with dementia can still do. Or come up with your own microstep. Each microstep moves you forward to a primary care partnership with your patients with dementia.